As people adhere to stay at home orders or self isolated during the early months of the COVID 19 outbreak, daily commutes turned into shuffles between the bedroom and the living room. Clicking Zoom links erased time spent walking to meeting rooms, and Netflix spilled into time otherwise dedicated to the gym. In short, a lot of people suddenly became more sedentary during the onset of the pandemic. Recently published research found people who continued to spend a higher amount of time sitting between April and June 2020 were likely to have higher symptoms of depression. A closer investigation into this association could play a role in helping people improve their mental health. The research team looked at how physical activity and sedentary behaviors are related to mental health and how changes to those influence the way people think, feel, and perceive the world. The researchers received survey responses from more than 3,000 study participants from all 50 states and the District of Columbia. Participants self-reported how much time they spent doing activities like sitting, looking at screens, and exercising, and how those behaviors compared to pre-pandemic times. Using standard clinical scales, they also indicated changes to their mental well-being. Example, depression, anxiety, feeling stressed, lonely. Survey data showed participants who were meeting the US physical activity guidelines, that is 2.5 to 5 hours of moderate to vigorous physical activity each week before the pandemic, decreased their physical activity by 32% on average shortly after COVID-19 related restrictions went into effect. The same participants reported feeling more depressed, anxious, and lonely. The researchers published their findings in the International Journal of Environmental Research and Public Health last year. Their latest paper in Frontiers and Psychiatry served as a follow-up to see whether the participants' behaviors and mental health changed over time. Participants filled out the same survey each week between April and June. In the second study, the researchers found that on average, people saw their mental health improve over the 8-week period. People adjusted to life in the pandemic. But for people whose sitting time stayed high, their depressive symptoms on average didn't recover in the same way as everyone else's. The participants who continued to spend a large portion of their days sitting experienced blunted mental health improvements. The researcher emphasized that finding an association between sitting and mental health is not the same as saying more sitting causes depression. It is possible people who were more depressed sat more, or that people who sat more became more depressed, or there could have been some other factor that the researchers did not identify. The researcher recommended people take breaks when sitting for long periods of time. People working from home can try walking around the block before and after the workday to mimic their pre-pandemic commute, which can benefit people physically and mentally and help add structure to the day.